Taoiseach, this is an urgent matter. This Friday, several hundred patients will lose their GP in the Monkstown Farm area of Dún Laoghaire, because there's a rule, which I wasn't aware of, that GPs, when they reach the age of 72, are compulsorily retired, even in this case, against their will. They want to continue serving their patients, but they're no longer allowed. And many of these patients who have mobility problems, chronic illnesses and so on are now going to have to travel long distances, and most of them have not even been told what new GP service will be available because their GMS medical card. The doctor can continue in private practice but can no longer provide for his GMS medical card patients. And I've appealed to the Department of Health to say, can this doctor have an extension, which he wants? His patients want him to have the extension, and they're just saying no because 72 is the rule, even though there's no rationale for the rule. But apparently there are 6 at least exceptions been made around the country, I found out for PQ. So can you intervene to ensure that hundreds of people do not lose their GP because of this ridiculous and arbitrary rule?
Deputy Palmer.
Thanks, Lascan Corley. Over 4 years ago, Sláinte promised, quote, Sláintecare, quote, universal single-tier service where patients are treated on the basis of health need rather than on ability to pay. Where are we today? A further embedded, deeply unequal two-tier system, the weaknesses of which were badly exposed by the pandemic. Almost 1 million people on hospital waiting lists, overworked and underpaid staff in our hospitals, and huge amounts of public money ending up in the private healthcare system through, for example, the National Treatment Purchase Fund. Then you have the resignations of Laura McGahey and Tom Keane from the Sláintecare Implementation Advisory Council, and then Professor Geraldine McCarthy, Chair of the Board of the South-South-West Hospital Group. In her resignation letter, she wrote that I've waited a long time for developments led by successive Ministers for Health and Government. However, recent information and my own experiences tell me we are no nearer to the required reform than where we were 6 years ago. Is the government actually committed to what was in Sláintecare, or is it just politically expedient to say you agree with it?
Okay, thank you, Lascan Corley. Just on that last point, I don't know what the circumstances are that necessitates the travel to Limerick. It must be regulatory or a particular aspect of the education programme. So we're open to any submissions from the University of Limerick in respect of with the Technological University with a view to having that completed here. So that's something that we're open to having pursued. Deputy Murphy raised the issue of the health needs and Sláintecare, and just to simply say that a lot of progress has been made. Deputy Lahart raised the issue of extra hospital beds, for example, and in the generality debate that's ensued, there's about 800 additional hospital beds this year, additional. That's the largest and biggest number of new hospital beds opened in a single year for decades. And that's the level of state investment in the state system that is now occurring. On home helps, about 5 million additional hours were provided for in this budget. The waiting list last year was about 7,250 were waiting. Now there's about 1,307 waiting for home helps. Now the next stage has to be to try and get more people into that workforce, and we have to look at work permits and facilitating of people coming into the country to work in our health sector, as well as training up and skilling up people in the home care health sector, which is growing and will continue to grow. We don't want waiting lists in that area because it's very connected to the acute hospital system. And then the Minister will be establishing a task force shortly and also announcing a waiting list initiative which will again concentrate on a further level of expansion of acute hospital beds, intensive care beds, but also the whole area of elective care facilities and ambulatory care facilities. And the Minister is close to bringing proposals to Government in respect of the ambulatory care in Cork, Galway and Dublin, additional electives that will be required as part of the Sláintecare programme. And that's more medium term in terms of obviously giving us the capacity to do the electives. And that in terms of the waiting list, and I've met with Tom Keane and Laura McGahey yesterday, and Deputy Murphy has raised that. I think their issues relate more to structural. In fact, they would acknowledge that a lot of progress has been made on a lot of fronts in terms of activities, levels, but that there's a fundamental structural, from their perspective, issue in terms of the role of the office within the Department of Health vis-a-vis the HSE, and that's something I will reflect on, and we will reflect on in terms of the structural approach to implementing Sláinte Care, but the government remains very committed to the implementation of the principles of Sláinte Care right across the board in all aspects. The Deputy Barry raised the issue of the Willis report. I dealt with that earlier in terms of organ retention. Now, there are 2 reviews underway within the hospital that are required. It was not in accordance with the guidelines and the rules and regulations laid out by the HSE itself in respect of the retention of organs, particularly in respect of post-mortems, and the need to have full consent with the parents in terms of what happens after the post-mortem and return of the organs to the parents for either burial or for cremation. But that did not happen on this occasion. And as I said earlier, the Minister is seeking assurances that this was not a practice across other hospital sites during the pandemic, and he obviously hasn't got a response to that yet, but is hoping to get a response to it. Deputy Boyd Barrett raised the Monkstown situation. Again, I'll talk to the Minister for Health in relation to that. In terms of that could be a medical council issue. It could be a regulatory issue in terms of that. Would be my own observation. If not, well, my view is if there's no alternative and the 72-year-old is here hale and hearty, then common sense should prevail and provision should be made for it. In terms of Citizens' Assembly on drugs, again, I will come back to the Deputy on that, because of now that we're coming out of COVID, we might be in a position to accelerate. There are about 3 areas that we said we would identify for Citizens' Assembly. One, I think, was the mayoral situation in Dublin. One is drugs, and I think your point about the decriminalisation of drug users is well made, and that this is fundamentally a health issue as opposed to a justice issue is well made also. So I'll come back to you in terms of the timelines around that. And in terms of Deputy MacDonald's point about the reconfiguration or progressing disability, again, I will talk to the Minister for Minister Anne Rabbitte in respect of that, in terms of what is essentially real difficulty in terms of progressing disability, which is taking resources out of existing special schools and then saying that they should access those resources through a central provision. And that's causing undue stresses and strains. It's not something I agree with, and I've made that clear to the HSE.
We're way over time. Thank you.